The U.S. Food and Drug Administration, or FDA, recently announced an indefinite delay on its proposed ban of formaldehyde in hair straightening products. This decision, prompted by a presidential executive order, has sparked outrage and concern among public health advocates. Formaldehyde, a colorless gas with a pungent odor, is a common ingredient in many hair smoothing treatments, particularly those marketed toward Black women. The proposed ban, initially slated for implementation in 2016, aimed to mitigate the health risks associated with formaldehyde exposure. This delay represents a setback for consumer safety and raises questions about the influence of industry pressure on regulatory decisions. The FDA's primary responsibility is to safeguard public health, and this delay calls into question their commitment to this crucial mandate. The FDA's inaction leaves consumers, particularly those from marginalized communities, vulnerable to the harmful effects of this dangerous chemical. It is imperative that the FDA prioritize public health over industry interests and swiftly enact the long-overdue ban on formaldehyde in hair products. Formaldehyde is classified as a known human carcinogen by leading health organizations, including the International Agency for Research on Cancer, or IARC. Exposure to formaldehyde has been linked to several types of cancer, including nasopharyngeal cancer and leukemia. The risks are particularly high for salon workers who are regularly exposed to the chemical. Black women are disproportionately affected by this issue due to the widespread use of formaldehyde-containing hair straightening products within the Black community. These products are often marketed as a solution to achieve smoother, straighter hair textures. The cultural significance of these hairstyles, coupled with the pervasiveness of Eurocentric beauty standards, contributes to the demand for such treatments. This disparity in health outcomes underscores the need for targeted interventions and stricter regulations to protect vulnerable populations. The FDA's delay perpetuates this inequity and raises concerns about environmental racism. In the absence of federal action, several states have taken the initiative to protect their residents from the dangers of formaldehyde. California, Maryland, and Washington have all passed legislation banning the use of formaldehyde in hair products. These state-level bans demonstrate a commitment to public health and set a precedent for federal action. Furthermore, a federal class action lawsuit has been filed against several chemical hair relaxer manufacturers. This lawsuit alleges that these companies knowingly exposed consumers to dangerous levels of endocrine-disrupting chemicals, putting them at an increased risk for uterine and breast cancers. This lawsuit highlights the urgent need for greater accountability within the cosmetics industry and stronger regulatory oversight from agencies like the FDA. The outcomes of this case could have far-reaching implications for the future of the cosmetics industry and consumer safety. The FDA's role in regulating cosmetics is paramount to ensuring the safety of products used by millions of Americans daily. However, unlike pharmaceuticals, cosmetics do not require pre-market approval from the FDA. This loophole allows potentially harmful products, like those containing formaldehyde, to enter the market without thorough safety testing. The agency's recent delay on the formaldehyde ban raises serious concerns about its commitment to protecting consumers from hazardous chemicals. It is essential for the FDA to prioritize public health over industry interests and to use its authority to enact and enforce stricter regulations on the cosmetics industry. The health of millions of Americans is at stake, and the FDA must act decisively to mitigate the risks posed by formaldehyde and other dangerous chemicals in cosmetics. Delaying the ban is unacceptable and puts countless individuals, particularly Black women, at unnecessary risk.